Welcome back to number 3 in a series of 3. Today is a CME on concussion in parasports. The reason why I picked this topic is because the question had never been answered. We asked this question in around 2019 when we first joined Sportsman Masters. We had a concussion topic and it was very long. But then the question came up, what about how do you diagnose concussion in para-athletes, or how can you decide this para-athlete has a concussion? There was no answer because there was not much information. Okay. So it was mainly up to the decision of the doctor on the day. So if that doctor is very experienced, your player is safe. If your doctor is inexperienced, your player might have higher risk because of their injury and the misdiagnosis of your concussion. So, is this group of athletes neglected in terms of concussion, in terms of recognition, guidelines, management, research and rules? Concussion in sports has a 5th consensus statement in 2017. They had a meeting I think last year and a 6th statement is coming out. There has been no consideration or mention of para-athletes in any of the papers. Concussion Recognition Tool 5, SCAT 5 and Concussion in Sports 2017 consensus statement had no specific guidance focusing on para-athletes. So the question is, do para-athletes not get concussion?
Athletes who play full contact sports know that concussions are always a risk. That's why there's so much research done on the injury. But that research isn't always helpful to athletes in wheelchairs. Doctors here at the Spinal Injury Center at the VA Hospital are working to change that.
It makes me feel good on the inside to know that if something was to happen to me, that the research out there will help.
Toy Adams is a known champion among the para-athlete community. She has won dozens of medals competing while using a wheelchair because of her disability.
When you play wheelchair basketball, you fall, you tip over. I play wheelchair football, and they go on the ground, they roll each other around, and no concussion yet. I think that's a good thing.
This Army veteran isn't afraid of a fall and loves the sportsmanship she experiences. Luckily, she's also never been seriously injured, but the risk is there. It's why Dr. Ken Lee, who oversees the spinal cord injury unit at the Milwaukee VA, and his resident, Dr. Michael Harper, decided to focus research on concussions, specifically in wheelchair athletes.
We want to afford the same opportunity for wheelchair athletes as an able-bodied athlete when it comes to sports.
When an able-bodied athlete is hurt, a series of tests can be done to determine the extent of the injury. The research is there, and it's effective. But many don't realize this hasn't always been true for athletes in wheelchairs.
When it comes to active sports, many of these athletes have a baseline medical condition, a brain injury, stroke, spinal cord injury. So a lot of the baseline testing that the able-bodied concussion do, our guys are already positive, and it's part of their medical condition. So you can't use the same type of evaluation or test that we use on able-bodied, but they all will become positive.
Sochi 2014 Paralympics.
Right in the middle, a few wheels popping there. Cassidy, and I think it's ball there for the two, and then, well, dominoes. Nothing ended up in the infield.
That bit of Australia lucky to land there on the grass. It's much harder on the track, so and that will take a bit of skin off some of those athletes. Lappin being lucky to land on the soft, comforting grass.
And Gucci went as well.
Sochi 2014. So, obviously, we have concussions in para-athletes. The current statistics, however, may not represent the real rate of injuries. So, Rio Paralympics 2016, the doctor who wrote the paper reported that concussion may be underreported. Despite several incidents where athletes suffered blow to the head, unsteady gait, and significant head injury, there was no concussion reported. London Paralympic Games 2012, football, 25% of all acute competition injuries were head, face, and neck, but still no concussion was reported. Sochi Winter Paralympics 2014, they had huge issues with 31 injuries to the head, neck, and face, but concussion was also not reported. So the two downhill skiers, maybe because Sochi's injury surveillance may not have included concussion or questions of concussion. They just did by anatomical parts instead. So there was no concussion reported. Pyeongchang Winter Paralympics, where they made some adjustments and they changed the rules. 4.8% of athletes with injury had head, neck, and face injuries. They had 4 concussions reported, 2 para-alpine skiing and 2 para-ice hockey. So let's go on to the meat of it. Definition of para-athlete is a sports person with an impairment. A disability is any restriction or ability to perform an activity in a manner within the range considered normal for a human being, and a disability is the result of an impairment. Okay. The athlete impairment list is very long. I'm not going to go through it, but I think you can just have this here and go through later on. Definition of sports-related concussion is long, complicated, maybe sometimes confusing. This is taken from the Concussion in Sports 2017 Berlin paper. The main gist, the keywords of your definition, if you ever head into a viva and you need to answer, the definition of a sports-related concussion is a traumatic brain injury caused by biomechanical forces, a direct blow to the head, face, neck, or elsewhere on the body that has impulsive forces transmitted to the head. You have rapid onset, short-lived neurological impairment with spontaneous resolution. You have functional disturbance, but it's not. It's only functional. It's not a structural disturbance. So you have normal standard imaging. You may or may not have loss of consciousness. You cannot. Symptoms cannot be explained by drugs, alcohol, medication, injury, or psychiatric illness. So, you kena concussion, you say this, I think should be
Oh,
ya ke?
ini A++.
A++. So, sports-related concussion is among the most complex injuries in the sports medicine fraternity to diagnose, assess, and manage. There is currently no perfect diagnostic test or marker for the immediate diagnosis of sports-related concussion. It is not possible to rule out a sports-related concussion when you have an injury event and transient neurological symptoms. Once you have a blow to the head and the patient has symptoms, there is no way you can rule out a concussion. So, why I chose this topic was, this is the paper. Nanti boleh simpan paper because it has the guidelines. So this paper came out. Finally, a first position statement on the concussion in para-sports group was published in the British Journal of Sports Medicine in April 2021. So I think it's very important for us to at least know that there is some guidelines when we're looking after para-athletes. The concussion in para-sports group is an MDT expert group. Remember the doctor earlier on in the video? He is in this group as well. Not first author, but somewhere there. They analyzed and created recommendations on concussion in para-sports. They follow the established domains of the 5th Concussion in Sports Consensus Statement. So if you have read the 2017 for normal athletes, it kind of mirrors that, except the headings are almost the same, except that they've tweaked it for para-athletes. So, what did they identify? Number 1, a para-athlete may have concussion even if SCAT5 is normal. I'm not very sure what you can do with this, because once you test the patient is normal, you have to make a decision based on the injury, based on the symptoms, if you're going to take him or not. SCAT5 is not validated for para groups. Existing concussion tools assume normal athlete function, such as normal vision, normal hearing, understanding with competence, normal speech, language, manual dexterity, and safe neck range of motion. Our para-athletes may not have these normal athletic functions. existing return to play programs do not take into account different disability types. Okay, so these were the problems they identified. What was in the statement, a very long paper, is one, they gave us recommendations on clinical assessment of the para-athlete concussion. Two, they introduced customized SCAT-5 for each sport-specific impairment. If you have a look later in that booklet, there's, I think, almost 75 pages. Each impairment has its own on-field review and its own off-field office review. They also talked about para-concussion consideration for return to play program. So, recommendation for clinical assessment in para-concussion is long because the paper is long. Concussion is a clinical judgment made by a medical professional. This one is important is because even if you don't have a medical professional on field and you have someone with a head injury and some symptoms, they must be assessed by a medical professional. Okay. This has safety implications to the athlete. It also has medical legal implications. SCAT-5 should not be used as a standalone to diagnose or exclude concussions. If a clinician has concerns regarding the assessment or RTP of a para-athlete with concussion or suspected concussion, you need to err on the side of caution and take them off. Extra for para-athletes is PPE for baseline cognition, function, visual and physical activity is highly important. In the 2017 paper for the normal athletes concussion paper, they highlighted that it's very useful to have a baseline SCAT or baseline PPE for your athletes. In this paper, they lifted it higher and said it's quite important to have a baseline, because if you have a patient who is already a para-athlete, in a complicated situation, you may not be able to tell whether this is really because of concussion or because of their underlying issues. They recommend that a team physician with prior knowledge of athlete pre-injury be involved in acute assessment of potentially concussed athlete. As this is a recommendation, they've also highlighted the problems associated with this type of recommendation. One, your team physician may not be able to come with you on your competition. Two, even if you have a concussion or an injury, your team physician is not going to be the one to go in to assess in most competitions. Most competitions is a tournament doctor who's assessing. Tournament doctor can't have knowledge of every athlete coming in. So there's still a lot of adjustments to be made, but this is their recommendation. So, SIP's recommendation, recognize and remove, is the same as our concussion, the original concussion recommendation. If you suspect a concussion, the athlete must be removed from play and no RTP until medical assessment. Even if your symptoms have resolved, like, look, there's no more problem, I'm fine. You must remove and they must be assessed. If the doctor clear, that is up to the doctor to clear the patient. SCAT-5, if you have any red flags, if anyone's not familiar with the SCAT-5, there's a printed version. So there's red flags there. So if you bring up any of those red flags, emergency medical services must be called and the patient must be assessed at hospital. Okay. And the extra for this is that if you're going to use an on-field SCAT-5, you need to use the customized SCAT-5 used for each sport-specific impairment. My suggestion is, if you know what sport you're going to cover and what impairment your patient has, review the booklet and then figure out what is your customized SCAT-5 for that specific impairment. So, example of customized SCAT-5 is really small. That's the reason why I gave the handouts on customized SCAT-5. So, yeah, the first handout is the on-field assessment. I chose absent globe, So, in your handout, there's the first page is customized on-field assessment for an absent globe. Means this patient don't have eyeball. If they don't have an eyeball, they're not going to be able to tell you, or things like double vision. They may already have double vision as a baseline. A blank vacant stare, you you may not be able to get that. And then things like balance, questions like on the symptom side, you need to have customizations for that. So this is what it looks like. It's a stoplight system. So if it's green, means you don't need to make any changes, continue. If it's yellow, you need to have considerations for the patient's disability. And if it's red, means you cannot use that question. You just remove it from your assessment. You don't take it into account. Okay. The second page is actually the off-field assessment. So off-field assessment is more complicated in para-athletes because there are questions like remember these numbers or the balance questions. If you have a patient with no legs or a single leg disability, a double leg disability, you don't have problems with the balance part. So I chose the absent globe because I think it's the easiest for us to understand, just to get used to the system. Red means don't use, yellow means please consider the patient's disabilities, and green means there's not much changes. Okay. Any questions about the on-field, off-field assessments? I know it's very small, so you know how to make it any bigger. If there's no questions, we'll talk about the recommendation for concussion management for para-athletes. So the concussion management, the headings are exactly the same. The first is recognize and remove. After that, you have a 24 to 48 hour period of rest. After that, you have a gradual return to daily activities. Then you can have your return to school or sports program. So that is in the next page of the handout, which is a landscape view, which is this. Very small here, but I think you have your handout. So the green means there's not much difference. Yellow means there's variation. So if you're looking after a patient, say with spinal cord injury, that's the first line. So just have a look at their variations. Okay. Any questions on the management part? It's outlined in the paper. I think today is mostly just introducing you to the concept of what we do with para-athletes and what is available for us. That paper you need to sit and read and then familiarize yourself with the customized Cat 5s and the return to play or return to school management program. Next is our summary. I'm finished. Concussion is a clinical judgment made by medical professionals. Cat 5 should not be used as a standalone to diagnose or exclude concussion. Clinicians concerned regarding assessment or RTP err on the side of caution, take your player out. PPE for baseline cognition, function, visual, or physical activity is highly important. They recommend that the team physician with prior knowledge of athlete pre-injury be involved in acute assessment of potentially concussed athletes, and a custom Cat 5 and custom para-concussion management guidelines is available. Now these guidelines are new, they're not validated, and they're based on expert opinion. The paper does state that they understand there is no validated questionnaire. Why? This is the best that they have, and obviously we need more studies for para-athletes groups to give us a better, more streamlined way of assessing para-concussion. Because this is very clunky, you have to look back and forward quickly. And these are my references, and